What if I told you that your child's sudden bedwetting or constantly having to pee isn't actually a bladder problem? What if it is one of the sneakiest and most common signs of constipation? In this video, we're going to pull back the curtains on these hidden red flags, like frequent urges to pee or that frustrating poop dance. We'll give you the awareness that you need to spot at the root problem early on in your child and show you exactly how to treat it effectively and on time. Hi everyone, I'm Dr. Eileen Shi, a board-certified pediatrician. I work holistically with parents who want a child-centered approach to solve their children's health issues. So if that sounds like you, make sure to subscribe to the channel for more content just like this. Constipation is super common in children, especially in toddlers and young children. And they present differently in children because the signs are not just about the poop or the bowel patterns. And as a pediatrician, I've seen children in the clinic that come in for various complaints like tummy aches, bedwetting, and here are some of the most common telltale signs of constipation that are not so obvious. Peeing at night. Now here is the surprising link between constipation and bedwetting. If your child is fully potty trained and has been dry at night but suddenly starts wetting the bed completely out of character, the most likely culprit is actually constipation. And here's the simple reason why. The rectum, where the poop is stored, sits right behind the bladder. When your child is constipated, a big, hard collection of poop builds up and makes the rectum swell. This swollen rectum then acts like a balloon and starts to squish the bladder next to it. And as you can imagine, a squished bladder has less room to fill up with urine, so it feels full much faster. And this sends urgent signals to the brain that your child needs to pee, like all the time. So when your child's constipated, their bladder is constantly cramped, and this makes them need to pee more often. And when this happens at night, like during a long stretch of sleep without a bathroom break, then suddenly bedwetting is much more likely to happen. Now this leads us to the next red flag, which is constantly feeling the urge to pee or frequent urination. As you can imagine, when the rectum is full of poop, and pressing against the bladder in front of it, the bladder feels a lot more pressure and fullness. This is what signals your brain that you urgently need to go. Sometimes a full rectum can also squeeze or restrict the urinary tubes called the ureters that let urine flow out of the bladder. And when these ducts are compressed, it can actually make it harder to fully empty the bladder, leading to something called urinary retention. You try to pee, but you just can't get it all out. Now, it's important to know that frequent peeing, incomplete emptying, and bedwetting can sometimes be signs of other medical issues like urinary tract infections or other psychosomatic stress. If you treat the constipation and these symptoms still don't clear up, be sure to check in with your pediatrician for a full evaluation. By the way, if you found this video helpful, please give it a like and hit that subscribe button so that you don't miss out on future content just like this. It really helps the channel. Stool withholding behavior. Now, parents often come to me saying, my child is just flat out refusing to poop, and ask what behavioral tricks they can do to fix it. Now, stool withholding behavior can be stressful for the whole family, and it is often mistaken as a voluntary act of a kid just being stubborn or making a choice not to use the bathroom. And yes, for brand new potty trainers, holding it in can sometimes be a power struggle or a phase, but for older kids or those who have been potty trained for a while, it's almost always a sign of something deeper. They're usually scared to go. This fear comes from past painful or negative experiences. Maybe poop was really hard and it was hurting coming out, or they had an anal tear, or even just a time when they felt really strained. So if your child suddenly starts to withhold, the first step is to start monitoring their bowel patterns and jump right into troubleshooting constipation with diet and simple home remedies, which we'll cover next. Hemorrhoids as a sign of constipation. Think of hemorrhoids as blood vessels around the anus and rectum that get stretched out from all the pressure. There are mainly two kinds of hemorrhoids, internal and external. The internal ones are usually out of sight and don't hurt, but they can tear and bleed when your child is straining. External ones are visible on the outside, and these can bleed and be painful when they get stretched. And the two most common ways that kids get hemorrhoids is from straining to push poop out and from sitting too long on the toilet. Now, how do you know if your child has them? Look out for these signs. Bright red blood on the stool, the diaper, or in the toilet bowl. There may be irritation or itching around the anus, and there might be visible swelling or hard lump around the anus. And now that we reviewed some sneaky telltale signs of constipation, aside from the obvious symptoms like straining and soiling, let's go over some effective and timely ways to address the underlying issue in a constipated child. For immediate relief within a day, depending on how long this has been going on or how much discomfort your child is in, a rectal suppository such as Pediatrician or glycerin suppository can result in a bowel movement, usually within minutes. For children with chronic constipation, Miralax helps draw in water and soften stool that sits in the rectum and therefore helps to relieve constipation. For more long-term prevention and maintenance, the following are exactly what I recommend as effective natural remedies that allow for healthy bowel movements in children. Dietary fiber. Boosting the fiber in your child's diet is the long-term #1 secret weapon for fighting constipation. Fiber does two great things to help them poop. #1, it bulks things up. This gives stool form and weight, which helps stimulate a healthy, complete bowel movement. #2, it feeds a happy gut. Fiber supports a healthy gut environment and beneficial gut bacteria, which keep the whole system working well. Try to sneak in more high fiber foods into your children's meals. And here are some common ones that I recommend most. Some of the superstars for high fibers are avocados, lentils, oat bran, the pea fruits for pooping like papaya, pears, peaches, plums, and prunes, and stocky vegetables, think broccoli and celery, chia seeds, and also fiber-enriched breads and grains. And this can be from cereal boxes or from breads that have a lot of fiber. One thing I would recommend is checking always the ingredient label and look for at least 6 grams of fiber per serving. It's also important to stay hydrated and limit milk intake. And it might look like your child is drinking enough water, but their intake can actually vary a lot day to day. To easily keep tabs on how much they're drinking, may I suggest you fill up a 16 to 20 ounce water bottle every morning and encourage your child to drink from that throughout the day. That way you can clearly see how much they've actually consumed. Also, if your child is drinking dairy, try to keep their milk intake to less than 20 ounces a day once they're over a year old, because milk can be constipating. Let's talk about routine potty breaks. For toddlers and school-age kids, scheduling a regular potty break might sound like a bit much, but it is super helpful for making sure that they have protected time for healthy bathroom habits. Little kids are so busy having fun and exploring that they often ignore their body's signals for peeing or pooping. So I often recommend scheduling a quick 5-minute potty break after breakfast or lunch. And this gives them a chance to slow down for a moment and check in with their bodies. It's really important to keep potty time quick and focused strictly on peeing and pooping. It sends a clear message to your child that this is a defined task. A common mistake I see is when parents bring in distractions like tablets, screen time, books, or even toys to ease your child into using the potty in the bathroom. But this actually backfires in a few big ways. First, having distractions in the bathroom can keep your child from focusing on the job at hand, which is pooping. Second, it can also lead them to sitting there for way too long and straining, which can increase the risk of things like hemorrhoids. Remember, using the potty is just a regular, everyday thing we all do for healthy function. So try to treat it that way. No fuss, no games, just get it done so that they can feel their best and get back to the fun. If you made it this far, thank you. I hope you now have a few solid tricks and tips for when you see these telltale signs of constipation like bedwetting, frequent urination, withholding, or hemorrhoids. Leave a comment below and let me know which tip you found most helpful for supporting your child's healthy gut. In our Las Vegas-based practice, we work with families one-on-one, offering concierge individualized care to each patient holistically and minimizing unnecessary pharmaceuticals to treat the root cause. To learn about how you can work with us, click on Become a Member and fill out the information so that we can schedule a time to chat. Thank you all for watching. See you next time as we navigate the world of holistic pediatric medicine.